Good afternoon, everyone, and welcome. We appreciate everyone being here today, including our esteemed panelists, as we discuss the future of reproductive freedom here in Illinois and across the country. I have a brief note as we get started about live captioning and ASL interpretation. We will have live captions at today's event. To turn them on, please click the closed caption button at the bottom of your screen. And we will also have live ASL interpretation. If you encounter any difficulties viewing the interpreter or seeing the captions, please feel free to message ACLU of Illinois events that's in the chat box. As we begin our program, I want to start by acknowledging that the ACLU of Illinois exists on the traditional homelands of many Indigenous people, including the Peoria, the Kaskaskia, the Piankashaw, the Wee, the Miami, the Muscatine, the Ottawa, the Sauk, the Meskwaki, the Kickapoo, the Potawatomi, the Ojibwe, and the Chickasaw nations. We hope you will join us on a journey that is just beginning. We must say the names of the First Nations as we acknowledge the bad legacy of violence, settlement, and displacement that Indigenous people have suffered and survived. And we must commit ourselves to the importance of reverting this common history by supporting Indigenous communities' continued struggles for respect, self-determination, and sovereignty as we begin to right the historic wrongs of colonialism and state violence. As we start today's program on reproductive freedom and its future, it is impossible to overstate how grim the outlook is for reproductive rights, not just in states like Mississippi and Texas, but in the approximately 22 other states that are primed either by trigger laws or legislative rumblings to further restrict reproductive rights should the Supreme Court overrule Roe or further cut back on its protections. 35 years ago, Illinois looked a lot like Texas. Each year, the Illinois General Assembly passed draconian laws restricting abortion. Each year, the ACLU went to court to challenge those laws as unconstitutional. But as we saw the handwriting on the wall, the chip away strategy that has been the history since Roe's inception in 1973, our advocacy partners and our legislative allies and we saw the need to develop new strategies. You've been part of the strategies to protect reproductive freedom here in Illinois. Together, we've advanced strategies that treat reproductive rights, including abortion, as healthcare. We've also restored Medicaid funding, enacted the Reproductive Health Act, and in this past veto session, through the Healthy Youth Act, repealed the harmful Parental Notice of Abortion Act. Those victories would not have been possible without you, our audience, our advocacy partners, and our legislative leaders, including Senator Sims, who joins us today. At this point, I'm going to turn it over to Khadine Bennett, our very talented Director of Advocacy, and our panel to discuss the work that still needs to be done on implementation and how to ensure our partners on the ground have the resources they need to protect reproductive freedom for everyone. Khadine?
Thank you so much, Colleen, and thank you to the panelists for joining us today, and thank you for folks who joined the panel to listen to what we have to share. So just a note about questions. We've received some questions when folks registered for today's conversation, and they've been weaved into the questions we're asking our panelists today. But if you have other questions, please feel free to put them in the chat and we will get to them if possible. So I want to start the conversation with Ameri, who is our director of the Women's and Reproductive Rights Project. We heard a little bit from Colleen about 2 recent cases in front of the Supreme Court. What do these cases and the nationwide onslaught of state attacks on reproductive healthcare mean practically for folks on the ground?
Thank you, Khadine, and thank you to everybody for being here with us today. The ability to get an abortion right now in the United States very much depends on geography. That's true right now because of state restrictions that have been particularly hostile in the last few years. And as Colleen indicated, it will be even more the case if the Supreme Court overturns Roe or significantly guts it, with more than 20 states poised to ban abortion if Roe is overturned. What we know is that when abortion is pushed out of reach, it hurts the most vulnerable among us. It hurts people of color. It hurts people who are low income or struggling to make ends meet, groups of people that already have barriers to obtaining health care. And this just adds on to that. I'll also add that a lot of the discourse that we hear lately is about women's autonomy and women's rights, but trans men and people who are non-binary also need abortion care. And those folks also already face barriers to seeking accessible, affirming reproductive health care. What is happening in Texas right now is a good example of what will happen on the ground if and when the Supreme Court overturns or significantly guts Roe. So Texas currently bans abortion after 6 weeks of pregnancy. It has an exception for medical emergencies. That exception is very vague and has a chilling effect. There's no other secret workaround. So right now in Texas, more than 85% of abortion care has ceased, while this Texas state law flagrantly violates the United States Constitution. So what that means for people on the ground in Texas right now, they have 3 options. There's no secret loopholes. They can leave the state. Where are they supposed to go? States surrounding Texas also have very limited access to reproductive health care in some cases, and are struggling. Clinics in those cases struggle to serve the people in their state already. Again, when you're talking about people who are already parenting or people who are low income, who have to take time off work, who may have to travel to a state that has a waiting period, to suggest that traveling out of state is an option is, really not feasible for many people. The second thing people in Texas can do is to self-manage an abortion, or the third is to be forced to carry a pregnancy to term in a state with one of the highest maternal mortality rates in the country. So that's the reality of what it looks like on the ground when abortion is banned or, so severely restricted the way it is right now, and the direction we could be heading, depending on the outcome of the Supreme Court cases that are pending.
Thanks, Ameri. And Alicia, you work at CAF, and you all are on the front lines in terms of folks who are seeking access to abortion care, both in Illinois and folks coming from other states. And Ameri laid out a little bit of what can be happening, but what have you seen? What have you as CAF seen as a result of what's happened in Texas and the fears and concerns that folks have?
Yeah, so in terms of, I'm just thinking about the fact that this year we've had a rise in callers, period. I don't know how much we can really separate the reasons why we've had an influx. I think part of it is the fact that we're still in the middle of a pandemic. There's great economic disparities in general when accessing healthcare. So when we think about abortion care, that's not any different. We've had 3,700 callers this year, and lately we've seen over 100 callers per week. And so when we compare that to 2018, where we supported 183 people the entire year, or even this month last year when we only heard from 218 people, which only sounds like, I can't even believe I'm saying only, because back then we were like, wow, we're supporting 218 people. But we have just seen this mass expansion of, or this increase in need in general. And we know with conversations with our partner clinics that they're also seeing more people travel to Illinois. They're preparing for even more of an increase as we see these threats and attacks on abortion care nationwide. I'm thinking, so CAF in general, we support folks in Illinois, but we also support people traveling to Illinois from a lot of different states. Mostly Missouri, Indiana, Wisconsin, and Iowa. And then a little bit more rare, but still frequently, we support folks from Kentucky, Tennessee, Louisiana, Texas, and Ohio. And then we also in Indiana, Nebraska, and Iowa, and occasionally in Kentucky and Wisconsin, support folks staying in their home states. And I think that that is a testament to the fact that Illinois does have less barriers in our surrounding states. The procedure itself is less expensive. And when we're thinking about these longer term or larger affronts to abortion care on a national level, we have to keep in mind Illinois and other states that have lower barriers to abortion care. Those are going to be key places where we have to be protecting and really supporting people in accessing this care. And I think to that point, I mean, I'm definitely going to talk about it later, but I do think, well, that sounds like really daunting, and it is really daunting. I feel like being on the helpline, this is on my mind every day, and I'm sure a lot of the people on this call, this has also been on your mind. But I do think something that I've held with me is the fact that this is not just Illinois or Chicago Abortion Fund working on this. This is a national effort. We have abortion funds in states across the country. We have providers and other advocacy groups that are all working together to make access a reality, even in the face of a landscape where access is being restricted daily, all the time. And so I think it's this balance between, on our end, really thinking about ways that we can creatively and proactively protect care, and on the other hand, really sinking ourselves in this, or I guess becoming aware of this reality, like what is the changing landscape? Where are we seeing these chips away at access, and what does that mean for our callers?
And just that one follow-up for folks who don't know about CAF or what an abortion fund does, can you briefly share some of the services you provide and resources that you provide for folks?
Yeah, I love this question because I think that even before I really started getting into CAF and working on the helpline volunteering with CAF, I didn't even understand fully what an abortion fund does. So it kind of feels self-intuitive. Abortion fund funds abortion. So folks call our helpline. We may do a lot of different things depending on the case. And I think that every case is different. But for some folks, we might send a voucher, cover their appointment, whatever gap they have to accessing care, we can help them financially, but we also do logistical support. So if folks need childcare because they won't have anybody taking care of their children while they're having the appointment, or they need to travel to get to the clinic where they're accessing care, we can help with that. We can help with travel. We can help with lodging, food while they're traveling. We also can connect them to any emotional support they need, or even, I know from my experience on the helpline, like it's kind of goes hand in hand. When you're helping people access stigmatized care, sometimes you're also going to be a part of someone's emotional support system going through this. We have recently been giving mutual aid mini grants. So for other needs that folks have that might not be falling under this like logistical or financial support, we can provide more comprehensive wraparound support in that way. But yeah, basically when people are trying to access abortion care, abortion funds like CAF and the rest of our sibling funds across the country, we're really helping people connect those dots, whether it's giving them resources, material resources, giving them information on how to access other types of resources, or at least giving them information on how to navigate like legal barriers or navigate insurance coverage, or just that emotional support piece of really being there for people and providing them affirmation and love and just care in a moment where they're facing a really hostile abortion access landscape.
Thank you so much. And just moving over to Senator Sims. So as folks on the call may know, Senator Sims was the Senate chief co-sponsor of the Reproductive Health and Access Act. He was the main sponsor of the Youth Health and Safety Act, which repealed the dangerous parental notice of abortion law, and has voted on and was a co-sponsor of House Bill 40. So I think folks can know that you've been a champion for a long time on these issues. Can you share a little bit? So we've heard a little bit about what's happening in other states and these huge attacks against the ability to access reproductive health care. Can you share how that's played out at the state level? So in terms of what's been the response from anti-abortion organizations or people as a sponsor of these bills, from what you've heard from constituents and others?
Sure, and thanks, Khadine. I also want to thank the ACLU for your work in this space. Without your tireless advocacy, Colleen, Khadine, the entire team, Ed, you've made this fight for us even more productive. So I want to thank you and go on record as thanking all of you for your work. I've received a number of different responses personally, but also looking at the legislative responses that we see. Usually you see that, they come with the typical arguments from those who seek to force birth, but then also simultaneously abandon those same lives once they're outside the womb. And, some of the responses that you've seen go from prohibition to criminalizing the use of reproductive health care, rolling back some of the progress that we've already made here in Illinois. For example, rolling back policy advancements like the Reproductive Health Act, or making reproductive health care allowable under Medicaid or under private health care or private health insurance. So you see those types of policy developments start to happen or legislation be introduced. But I think it's also important to note that the same individuals who are sponsoring those bills and sponsoring and which seek to roll back those policy advancements are the very same individuals who vote against budgets who will invest in the lives for the individuals that they purport to support. Individuals who don't support budgets, don't support advancements in eliminating healthcare deserts and economic deserts and education deserts and criminal a criminal justice system that criminalizes lives and criminalizes poverty. So they rail against those types of policies, but then try to force individuals to try to force birth on individuals and not protect the lives once they're here. But I'm more focused, and I have been more focused on the tremendous support and words of encouragement that I've received from regular people, those who live within the district that I represent, but also those who don't live in the district I represent. I have had so many individuals who have sent me emails and notes and messages on social media, or who've even stopped me on the street to say thank you for standing up and having the courage to do the right thing. Recognizing that it takes courage to do the right thing, but also it takes it is difficult for some. I don't necessarily subscribe to this, but it's difficult for some to stand up to the mob lobbying efforts where the loudest in the room will try to shout you down or seek to bully and silence individuals, as opposed to engaging in legitimate policy deliberations to come up with solutions that protect our young people. And that's what the repeal of the Parental Notification of Abortion Act and the Youth Health and Safety Act was all about. It was about creating an environment that protects those who are crying out for assistance, while at the same time recognizing that all family relationships and realities aren't the same. And I think that, and I talked about this during my private discussions with individual members leading up to the passage of the Youth Health and Safety Act, but even in floor debate. I encourage members to take a step back and look at the reality which exists in not just in their homes, because not every home is the same. And there are legitimate homes where young people feel threatened, they feel in danger. We have to lift those voices up. We cannot simply allow those voices to go unheard and go unsupported. And that's what the effort was all about. And that's why I say I focus so much on the positive input that I've received from so many across our communities, because that's what fuels this work. Those voices who say not just what you want to hear, but they want to put out the realities and the reasons why the realities exist and why we should be focusing on them. And that was what was so important for me in this moment.
And just to add to that, I know when we were talking to legislators about the need to repeal the parental notice of abortion law, I heard from folks, and I'm sure you heard from folks, where they're like, why? Why do we need to do this? Why do it now? Can you share a bit about, one, why did you decide to be the main sponsor of this attempt to repeal this horrible law? And also, why now? Why was it important for it to get done when we did?
Absolutely. Can we speak candidly for a moment?
Please, it's just your 100 plus of your close friends.
Those are my closest friends. You know, I quite frankly, I get confused by this hypocritical position that individuals talk, you know, they talk about, you know, my body, my choice when we're discussing mask requirements and vaccinations. But then when it comes to decisions where an individual makes legal healthcare decisions about their own body, then they feel like they have some right. So, you know, I decided to sponsor the bill because of the young people that I come into contact with, and quite frankly, for the parents who are building strong relationships with their young people, those who live within the district I represent, but frankly, those who are throughout the state and also across the country, because the Youth Health and Safety Act is a model for how we develop policy in this area, where we support parents, we support families, but most importantly, we support the young people who are going through the pregnancy in the first place. I was thinking about those young people who fear physical or emotional abuse. They fear homelessness. They fear alienation from their family or friends, or being forced to carry a pregnancy to term, even in cases of rape and incest. And that, again, that's why when I come back to the hypocrisy that we hear from folks who say, you know, you don't have the right to tell me to put a mask on or to get vaccinated, but then I have a right to tell someone else to make a decision, even in a case of rape or incest. To me, that's just fundamentally, patently unfair. You know, I thought about those young people who I come into contact with every day, including my own daughters. My wife and I, we have two beautiful young daughters, and we try to have those very authentic conversations with them, even when they're uncomfortable. And being able to have those authentic conversations, that's when, and you see, and studies have shown, of the young people who do decide to exercise this type of healthcare, when they have those strong family relationships, they involve their parents or a trusted loved one, trusted adult loved one. And when they don't, there is typically a case and a reason why they don't. So I sponsored it because I was thinking about those individuals and those realities, because if we leave those young people on their own, then we are going to, you see that they start their lives are irreparably damaged, and the trauma which can be then passed on is generational. And we simply cannot walk away, bury our heads in the sand, and think we have no responsibility to improving the quality of those lives.
Thank you. And Alicia, I know that CAF was part of the coalition to repeal this dangerous law. And so as somebody who is on the front line in terms of talking to folks who are seeking care, can you share some examples of the harm of the parental notice of abortion law being in effect for the last around 8 years or so?
Yeah, I can. I think something that I will say is that I don't want to share any like specifics from our callers, just to put that out there, but mostly for privacy reasons, but also they're not my stories to tell. But I can talk more generally about the way that we saw PNA being harmful for our callers and for young people in our state. And as Senator Sims mentioned, also folks coming from out of state. In the case of young people, I mean, we've talked about this, we know this, but getting an abortion is time-sensitive healthcare, just like it is for everyone. But in order to get this time-sensitive healthcare, telling your parents or your guardians might not be safe. And it is just something that is an extra barrier to navigate. In terms of on our helpline, we know that going through judicial bypass, trying to navigate a court system, especially when we're thinking about Black and Brown youth, a court system that is not meant for them, that has a history, a racist, classist history, and is entrenched in the prison industrial complex as a whole. We can talk about the ways that for youth, and again, especially for Black and Brown youth, this process is daunting, can feel insurmountable. It has to be done in secrecy, which is another piece. Navigating a court system without having your parent or guardian know about that, that's is almost an insurmountable challenge, but one that youth had to do in order to access the care that they needed. I can also go into the fact that when we are thinking about, again, like folks having to navigate a host of barriers, this is not the only barrier that young people are facing, and this is not the only barrier that people face in terms of like legal barriers to get abortion care. We think about financial access to abortion, which is why young people would be calling our helpline. But we also think about logistics of getting to your appointment, logistics of missing school, missing work. And these things aren't exclusive to people who don't have to navigate or wouldn't have to navigate parental notification. Youth just have these barriers compounded on them when they are forced to notify or get the consent of their parent. I think that this was kind of a general overview, but in terms of our helpline, we just sent an email out to all of our case managers. We have been celebrating the repeal of PNA, and I know that we're all really excited for June 1st to come so that young people don't have to navigate this barrier anymore in Illinois, or if they're traveling to Illinois. And also the fact that this means that we're one step closer to realizing reproductive justice, realizing the fact that everyone, including youth, deserve to make their own decisions about when they're starting their families, if they're starting their families, and how they're starting their families. And yeah, we're very excited about the fact that PNA has been repealed. It's something that was high time to happen, and we're really excited to see where this momentum takes us. And the fact that I think when we were organizing around PNA, we really made great headway into the right direction for the future of reproductive justice in Illinois.
Thank you. And Ameri, when the parental notice of abortion law went into effect, the ACLU created this bypass coordination project. Can you share a little bit about why the project was created, the work that the project does, and the current status of the project?
Yes, so young people who can't notify a parent of their decision to have an abortion do have the option under the law of going to court and asking a judge for a waiver of the requirement, what we call a judicial bypass of the parental notice requirement. So we operate a hotline that young people who need to go to court and with this request of the judge can call, text, or email, and we will connect them with a pro bono attorney who will go to court with them and help them through the process. And we're operating it now. We'll continue to operate it until June 1st when the law gets off of the books. I will say that, we do everything in our power to make the process as easy for young people to navigate as they can. But all of the obstacles that Alicia discussed are there for young people having to go to a judge and talk about all of their personal circumstances. I think most adults are nervous to talk to judges. It's just not a good process for young people to have to do, and we're really looking forward to getting out of that business on June 1st so that young people can get the health care they need without additional obstacles.
Thank you. And Senator Sims, I remember, I don't know what day of the week it was, I got a call from you about an idea to add to the repeal of the parental notice of abortion law, and that was the creation of a bipartisan working group. Would you like to share how you came up with the idea? What's the goal of the working group?
Sure. The working group was there to create the space for these authentic conversations, but also to have these authentic conversations about the resources which are, but quite frankly, the resources that aren't available for young people who become pregnant or planning to become pregnant or who are parenting. And as I mentioned, we have this debate, and we've had this ongoing national debate about whether or not we should have that a pregnancy be carried to term or not, as opposed to understanding when I think about, and I am going to be personal for a moment. I think about the reality which existed when my wife and I became pregnant. There's no manual for when you become a parent. There's no playbook. So if you don't have a good support system around you, you are going by what you think is right. And think about that. And I was in my 30s. My wife was not in her 30s yet, but we were older. Think about that reality for someone who is 13, 14, 15 years old, or 16 or 18 years old. Think about that reality. These are young people who studies have shown that brains don't develop until you are into your 20s. And for individuals who have not fully developed, they need resources to be successful. They need investments in how to parent. They need investments in where to go if they don't have that support system. So as we've been talking about, Alicia mentioned individuals who are then removed or alienated from their families because an individual becomes pregnant. Then they are now cut off from the family support system that they would have. So we've got to create pathways for individuals to then have those supports so they can be successful. It is not, again, we are having these discussions about forcing someone to carry a pregnancy to term without then giving them the tools they need to be successful when the pregnancy has come to term. So the working group was a brainchild to figure out what resources are there, and then once we identify the resources, how do we get them in a tangible way into the hands of individuals so they can be good, they can be used for good. So we wanted to put together this task force to, one, identify resources, but two, to also dispel some of the myths that are out there about what reproductive healthcare is and what it isn't. Because you hear so many folks talk about what reproductive healthcare is and how particularly the parental notification of abortion, which in all actuality is really just a backdoor way to stop the use of reproductive healthcare. It is not about empowering parents. It is not about ensuring that healthy family communications start. It is about making sure there is another barrier placed in the way of using reproductive healthcare. And once you understand what we are trying to accomplish, you create these pathways for success to happen. And I'm very proud of being able to get that portion of the legislation across the finish line, because this is not just a one-off. And I think that's why I often say, and I credit the ACLU with the work that we're doing to create these pathways, because this is not a one-off discussion or one-off fight. This is about long-term health in this area, and the working group will help to make those pathways, to create those pathways, but also make sure they stay strong and stable.
And a couple of the things that I really appreciate about the working group is, one, 10 out of the 26 spots are designated for young people under 18, so they can be part of the conversation around issues that impact them. And the other component that I really appreciate is that what we've heard from folks who go through the bypass process is, the fears that they have, that their parent will kick them out of the house, they won't pay for college, all of these things. They already have a child and they aren't able to be in a place where they can parent. And what it does is it offers resources, identifies gaps as it relates to housing, education, childcare, like the basic things that folks need, young people need, especially if they're deciding to parent or if they don't want to parent. So I think it's really exciting. So if you know people in your life under the age of 18 who might be interested in being part of the working group, please let them know that it will be something that they could look forward to applying for next year. So I want to give a big plug for that, because it's really important to get the voices of young people. So we've talked about PNA and PNA repeal. So just transitioning around the Reproductive Health and Access Act, Ameri, can you share a bit about what the now law does and why it's important in Illinois?
So the Reproductive Health Act, what we call the RHA, was passed in 2019 because we could see the writing on the wall for the way the Supreme Court was heading and the direction that reproductive rights were heading in this country. One of the most important things that it does is write into Illinois state law the right to an abortion, and codifies Roe versus Wade. So if Roe is overturned by the Supreme Court if the right goes away at the federal level. Here in Illinois, we still have that right explicitly written into state law. And the RHA is also broader than just abortion, so it covers people's ability to make their own decisions about a whole host of reproductive health care, so things like decisions to use or not to use birth control, for example, and decisions around childbirth, including when and how to give birth. So there's a lot of protection in the law. The other big thing that the RHA did was require private insurance companies to cover abortion care if they cover maternity care. So in 2018, we passed HB 40, what went into effect in 2018, here in Illinois to require Medicaid coverage of abortion care, which was a game changer for folks who rely on Medicaid for their insurance coverage. And the RHA closed the gap and now requires private insurers in Illinois to cover abortion care as well. So we're doing a lot of work. Our work is continuing on implementing the RHA. We want to do a lot of know your rights work to make sure that people are aware of their rights under this law. We want to make sure that insurance companies are complying with the private insurance coverage requirement. And another aspect of the work that we're doing under the RHA is because it applies to everyone in Illinois, including explicitly people who are in state custody, making sure that people who are in prisons and jails in Illinois also are aware of their rights and are not experiencing infringements on their rights to make their own decisions about their reproductive health care. But right now, as we stare down a potentially bad Supreme Court opinion, the most important thing that Roe is doing for us in that regard is codifying, or the RHA is doing, is codifying Roe into state law.
Great. And so it's always great to pass legislation that become law, and it's always important to do the implementation. But Alicia, can you talk a little bit about the practical, like how has this been playing out on the ground in terms of the passage of House Bill 40 and the RHA? What does that mean for people? What have you seen in your work?
Yeah, so HB 40 has been so like I can't even articulate how transformative it has been for calf collars. And we're so proud of its passage. We know it was made possible due to coalition work across the state and amazing elected officials who are really championing this bill and really keeping in mind our collars, and which that's something that is, I can't thank everyone who is a part of that enough. Also, we were just talking about this, but really looping in and connecting abortion care to other types of reproductive health care is a huge part, an important part of busting abortion stigma. We know that abortion is healthcare, just like any other type of reproductive healthcare is. And when we codify that, when we have that language in our laws and we have that connection in our laws, that is just a part of busting abortion stigma that separates abortion care from what it is, which is healthcare. And I will just say, in terms of on our helpline, the best feeling in the whole world is getting a call from someone who is an Illinois resident, who has Illinois Medicaid, who is stressed out about how they're going to pay for this time-sensitive, essential healthcare, and getting to tell them that actually it's going to be free because you're in Illinois and you have Medicaid, and it just lifts a huge burden off of their shoulders. And then we can get down to the nitty-gritty, figuring out transportation, childcare, any other logistical needs. But it's amazing that this huge cost is covered, and we know it should be covered because just like any other healthcare, Medicaid should help with that cost. And then even thinking about the flip side of that, I feel like for me, it's always really hard when we get out-of-state callers who are covered by under Medicaid in their own state, coming to Illinois or trying to get care in their home state who can't use their insurance. I just think about the ways that if this type of legislation was more universal, if we were able to have, if we were able to fund abortion on a nationwide scale using universal healthcare, anything like that, just how transformative this type of coverage for abortion care would be. And we see that on a small scale in Illinois, but my brain just dreams about the ways that we can make that even more accessible for more folks. I think talking about like one other small thing is Medicaid presumptive, I guess not a small thing, I will not say that, it is a huge thing, is Medicaid presumptive eligibility. We know that abortion care is time sensitive and you can't always wait on an application to go through in order to access care. So there's certain clinics in Illinois that do presumptive eligibility, which means that if you are likely to be eligible for Medicaid coverage, then you can get free abortion care. Another really huge transformative thing that has really helped our callers. And then just one last kind of thing that I'll say is that we are also on the ground kind of seeing the ways that legality and this specific law doesn't necessarily cover all Illinoisans who need support in accessing abortion care. There's plenty of private insurance loopholes and bureaucracy that prevent folks who have private insurance coverage from utilizing that coverage. Also, when folks have Medicare and Medicaid stacked on top of each other, the billing process precludes them from getting free abortion care just because of the Hyde Amendment, which prevents federal funding from covering abortion care. And then also on top of that, we know that there are a lot of other barriers that our callers face. And those some of them can't be legislated away, but are things that we have to contend with when we're thinking about people who are sitting at an intersection of a lot of different oppressions, trying to access something that is essential care. But yes, we'll double back and say HB 40, this type of legislation is huge, but the fight doesn't stop there, and we all know that, and I think that's why we're all on this call. But yes, thank you for that question. I love talking about Medicaid because it's something that makes me really happy on our helpline.
Yeah, and I think you hit on a really important point in terms of, in Illinois, we were both lucky, but it took a lot of work in order to pass House Bill 40, repeal of the Parental Notice of Abortion Act, and the RHAA. They were years long in the making. And I guess this question is for Senator Sims. I know some folks, when they're listening, they're like, oh, great, Illinois is awesome. That was probably easy to get done. Can you share with, and I think the perception is we're a Democrat-controlled state. There are tons of pro-choice legislators. You should be just cranking these protections out. Can you share with folks any of the difficulty or hurdles that you experienced while you've been sponsor and chief co-sponsor of these kinds of bills?
Absolutely. One of the things that I've come to realize is that the anti-abortion crowd is very good at marketing. They tap into the emotions of good people who only want what's best for their children. They only want what's best for the children they encounter or young people they encounter. Without recognizing, as I've mentioned earlier, that every family relationship is not the same. Oftentimes folks come to these relationships without recognizing that serious healthcare deserts exist and barriers exist to having a life that having a great life for the person who is pregnant, or if there is a child that's brought into the world through a forced birth, what that life might look like. So understanding those barriers very real barriers to passage of any of these pieces of legislation. And you have individuals who, I mentioned earlier, this mob lobbying mentality. There are folks who, as we were debating RHA, and even when I initially introduced the P&A repeal without the working group that was ultimately incorporated, that working group that was incorporated came from some of those discussions. But there were also, when the bill was initially introduced, there were folks who flooded my legislative office in my district office, but also my legislative office in the Capitol, with really some of these vile statements. And there were people who would call and say I was going to hell. And there were some of these really nasty things said to my team. So there you have that reality because that's in there. You have a number of individuals who don't want to put themselves or their teams through that type of lobbying effort. But then also you have individuals who are subject to this marketing campaign on the other side. For instance, as we were working towards passage of the Youth Health and Safety Act, there was this narrative that the parental notification of abortion somehow combated human trafficking. Now there is no nexus, and there's been no widespread link between the use of the parental notification of abortion and human trafficking. But the marketing campaign, it was certainly effective. And when you have individuals who are out saying, well, this infringes on parents' rights, those are the types of arguments that folks who are family, they love their community, love their family, they want to protect them both. They are hesitant to wade into these waters, as opposed to having discussions about the widespread policy debate and discussions that have to happen in this area. Because if we are going to protect all of our young people and every woman in this discussion, we've got to look at it from a policy perspective. And it was very challenging, be it RHA, be it the Youth Health and Safety Act, because the marketing campaign that goes on, it's one that I'm trying to adequately do it justice, because when you have individuals who come to this space and they see it at they hear it at the grocery store, they hear it at church, or they hear it from their families, they would rather be, even though they are pro-choice, there are some who would say, I would rather not deal with the blowback that I'm going to exhibit, as opposed to stepping into these waters. Whereas for me, I look at it as we have a responsibility. If we do not protect the rights that these young people have, or that women have overall, then we are going to lose. And we look at the Illinois, the impact on Illinois. But as I mentioned earlier, there are states across the nation where the only hope they have for advancements in this area is looking towards Illinois and the advancements that we've made to show that it is possible. So while there are challenges, I think we still have a tremendous opportunity to show the entire country that we are leaders in this area.
Thank you. And to go to Ameri about thinking about challenges once we have the laws in place, challenges that still come up in terms of not just legislation that's passed to undermine those gains, but litigation. And we have a question from the audience about the status of any legal or administrative challenges filed against the RHA. Do you have any updates or anything to share on that end?
Yes, so Senator Sims talked about the marketing effort, and it's really a wraparound effort by anti-abortion forces, and they've sued to challenge the RHA's insurance coverage requirement. There's an administrative complaint that's been sitting at the federal level with the Office of Human Rights. And then there's also a lawsuit proceeding in state court in Illinois. And recently, one of the claims was dismissed from that case. There's still a religious freedom claim that's proceeding through the state court, but a claim under the Healthcare Right of Conscience Act was dismissed. And unlike federal birth control mandates that apply penalties on employers who don't comply with them, the Illinois insurance coverage requirement for abortion care doesn't put those same kind of penalties on employers. So it's not really analogous to cases like Hobby Lobby that people are probably familiar with birth control. But so it's still proceeding, but has been narrowed down a bit in state court. But it's a good example of how we really can't ever take our foot off the gas.
Great. And this question is open for whichever panelists want to answer it. But there are some people who may think, okay, so our job here is done. We have these laws that are passed. P&A is going to be repealed next year. So access to reproductive health care is pretty easy for everyone in Illinois. There's nothing left to do. How can any of you share any of the other things that need to happen, or what challenges still exist for folks who are seeking reproductive health care?
I can start, and I can say, because we've seen some questions about the national strategy, and one thing that could happen is Congress could act and pass the Women's Health Protection Act at the federal level to codify Roe at the federal level, so that Illinois is not just one example of a good state, but we can even the playing field across the country. So that's one thing that could happen.
Yeah, I was going to echo the same thing Ameri did. I think it's important that we and I've talked a lot about Illinois being this beacon for reproductive healthcare hope around the country. The last several weeks and months, I have been meeting with legislative colleagues from around the country. So I think that it makes sense for us to have a two-track strategy. One, continuing to make sure that we're advancing and we're protecting the advancements that we've made here in Illinois, but then also on the other hand, reaching out to our federal partners, our friends in Congress, to talk about passage of federal legislation that would enshrine these rights into federal law, but then also as an offshoot of that strategy, reaching out to the other into some of these other states where these battles are going on. What I found is we cannot sit on the sidelines and let the reproductive health care decisions be made for us and to be taken away from us, but instead, for us to get involved in them whenever these debates are happening.
I can speak a little bit to, I definitely want to echo the fact that we're on a national scale facing attacks to the legality of abortion. We are aware of this. This has been an ongoing and sustained attack on the right to have an abortion, but there's also at the same time many barriers that aren't necessarily encapsulated under a rights-based framework. We're thinking about social interpersonal barriers to accessing care, some of which we talked about when we were saying how important it was that we repeal P&A, but even beyond that, thinking about stigma, thinking about misinformation, even from providers or from crisis pregnancy centers. We think about lack of familial support or partner support, and even like internalized shame around abortion. At Abortion Funds, we help folks with logistical barriers. Some of this can be alleviated with legal protection in terms of folks who are traveling to avoid restrictions, but there's also logistical barriers like having to take off time from work if you don't get sick leave, a lack of financial support, thinking about having to figure out transportation, lodging, childcare. There's some things that can be addressed legally, but also some things that are much more larger structural change. And I think something that I just wanted to uplift is this idea of a reproductive justice framework, kind of thinking about the way that there is a project of protecting individual rights, but individual rights at the large grand scheme of things aren't necessarily all we need to do, all we can do in order to have abortion liberation, but also just like liberation in general. I'm thinking about the ways that racial justice, economic justice, a liberated view of gender, thinking about without bodily autonomy and freedom for all of us in community with one another, especially like trans folks, gender nonconforming folks, queer people, Black and brown people of all different intersecting identities. Without liberation for all of us, we're not going to achieve reproductive justice or any sort of justice in any way, shape, or form. And I know that that sounds kind of large, or maybe that it doesn't have like a specific action item to target, but I do think some ways that we can think about how we are doing that is becoming informed resources on abortion in our communities, saying the word abortion, not shying away from having these hard conversations with our family, with the people around us. And then also thinking critically about the ways that the issues that we care about, or the issues that we're, so today we're talking about abortion access, but also like reproductive access, the ways that those issues are not isolated from other forms of liberation, other fights that we need to be fighting, because none of this exists in a vacuum. And I know on our helpline, our callers are facing a host of barriers, some that we can address on our helpline. Sometimes we can be like, okay, we can get you to your appointment. We can figure out this logistical challenge. But some of our callers are facing things that are outside of the scope of what we can do, and that make this work sometimes feel really daunting, because it seems like, you know, if your caller is experiencing houselessness, if your caller is experiencing domestic or partner violence, like there's some things that we can do to make your situation easier in this moment. But in reality, there's a lot of structural change that needs to happen. There's a lot of ways that we need to make sure that our movement isn't leaving behind other movements for the autonomy, freedoms, and liberation of other people, because without everyone being free, none of us are going to be free. So that was like a really maybe nebulous kind of answer to the question. I think it's
was great.
Yeah, and we have 1 minute left, and with that minute, for Senator Sims and Ameri, if you can give a quick one thing people who are still on the call can do, should read, should act on, what would that be? Let's start with you, Senator Sims.
Sure. I would say reach out to your local elected officials. You know, former House Speaker Tip O'Neill said all politics is local. And as I mentioned earlier, from the comments that I hear, I always start with the ones that are in the district that I represent. So I think it's important to reach out to your local elected officials, not just when you need them, but all the time. And there was a comment in the chat that the point is that we are always one election away from the gains we've been made being rolled back. And I think that's important for us to know. We're coming up on it, and I don't want to get too political, but we are coming upon an election cycle where all 177 members of the General Assembly will be on the ballot. The governor will be, and all constitutional officers, including the governor, lieutenant governor, the attorney general, will all be on the ballot. So it's important for our friends to stay engaged in this work. And when you know that individuals who are with you and have a stake in this work are doing that, are in the arena, in the electoral arena, we should help them, because that's the only way these policies are going to continue to be protected, is if we stay engaged. So I would say reach out to your local elected officials. Do it now. Do it consistently, so that we make sure that we are all on the same page. And thank you so much for having me. This was an absolute pleasure.
Thank you so much. And Ameri, any quick next steps?
No, I was going to say the exact same thing. I think it's not luck that we have great rights, strong rights here in Illinois. It's because people engaged in the political process. And I think we want to continue to thank our legislators here for doing that work.
And thank you to our panelists. Thank you, CAF, for the work that you're doing. Folks should go to their website or social media to learn how to be involved. Thank you, Senator Sims, for all of the work that you've done as a champion, and Ameri for the work that you've been doing on the legal end of things. Thank you, folks, for attending, and also stay tuned for more information about upcoming events, and hope everyone has a great day. Bye.